The most common kind of toe deformities that I tend to see in my clinic are bunions called hallux valgus, claw toes, and hammer toes. So there's a spectrum from adolescents to geriatric age population who get these deformities. Sometimes it is an effect and not the cause, and it's quite crucial to know what brings this on. The common causes that we tend to see are bunions, and most of the time the cause is idiopathic. In terms, we don't know the reason for that, but it is associated with people who wear like narrow footwear. Sometimes the other deformities which present in the toes may be associated with some neurogenic abnormalities, and the cause can be beyond foot and ankle. It could be coming from your spine, or even if you've got like tight gastrocilious complex, you tend to compensate by clawing your toes. So there are various reasons why people come with various toe deformities, and sometimes it could be just genetic, the way you're born with. The toe deformities, the way the foot is conceptualized is its foot is like a tripod. So whenever one of your tripod leg is not doing its effective function and it's turned outwards, or if the toes are clawed in such a way that they are rubbing on top of the shoes, then you might need something doing about it in a form of surgical intervention. Typically, my aim of treating the toe deformities is to restore the normal tripod mechanism of the foot. So if somebody has a bunion or a hallux valgus, it's after the failed conservative management, the surgical option would be to make your big toe straight, which would involve a surgery in which we make some cuts to your bone and just move the bone in a way. We refashion it in such a way that it's aligned and your tripod is restored. And if it is a claw toe deformities, if they are flexible, what we do is we release some tension in your toes, which move your toes downwards. And sometimes if they are fixed, we may have to fuse them or shorten them at the level of your knuckles of your toes. Surgery is required when the tripod mechanism of the foot is inefficient, and that will have an effect on the way you walk, and the biomechanics of your foot are changed, which in turn have got a knock-on effect on your knees, hip, and your back. So to restore the biomechanics of the foot, I would restore the alignment of the toes and the foot and the hind foot.